let's say an 11 or 12-year-old asks a teacher or a principal at school, I want to use different pronouns, I want to use a different name. And the reason they're making that request is because they're experiencing gender dysphoria. Now, on the surface, those requests may seem benign, but it is important to recognize that accommodating that request is a form of psychosocial treatment of a mental health condition. And as much as I respect teachers and principals, they know full well that they are not authorized to treat a mental health diagnosis.
For Rebel News, I'm Tamara Ugolini here in Baddock, Nova Scotia, Cape Breton, to bring you exclusive on-the-ground coverage of the Free Speech in Medicine conference that will take place over the course of 3 days this weekend. And the first speaker to speak on Saturday morning is Dr. Ken Zucker. He's a canceled psychologist who speaks on the topic of gender dysphoria and how science and politics have subverted the ability of psychologists to accurately and adequately treat their patients. We're going to have a discussion about his speech and ask him some questions. Stay tuned.
In mid-2015, the clinic was closed. The psychiatrist I was now working with left the CAMH and secured a position elsewhere. Trainees were reallocated, and I was fired after 40 years being at the Clark Institute in CAMH. Human Resources was kind enough to offer to pay for my taxi home that day. But I complicated things. I said I drove today.
Rapid onset gender dysphoria seems to be a new subtype of kids that we're seeing over the past 10 or 15 years. And by rapid onset, it means that these are adolescents who did not show any signs of gender dysphoria as children. They only started to express questions or concerns about their gender identity around the time of puberty, grade 6, 7, and 8. So these kids are actually very different from prepubertal kids who show signs of gender dysphoria and socially transition. The rapid onset kids have not socially transitioned when they were younger because they weren't showing signs of gender dysphoria.
Is there any sort of mental health correlation even that you're beginning to see or you've seen a little bit thus far in the differences between rapid onset and those who actually have clinical dysphoria?
Well, I would say that kids who have rapid onset gender dysphoria have gender dysphoria, just like kids who have early onset gender dysphoria have gender dysphoria. The difference, in part, is that the factors that have led these kids to develop gender dysphoria has to be different, because one group is early onset and another group is late onset. I would say that based on various lines of research, on average, kids in both groups have more mental health problems than kids who are not referred clinically. What we don't know yet is, are there unique differences between early onset and late onset gender dysphoria in terms of other mental health issues? So, for example, one line of research we could explore is, do the rapid onset kids with gender dysphoria have a higher rate of co-occurring autism spectrum disorder or autism traits versus the more classical early onset kids? Or another parameter we could look at is co-occurring depression and or suicidality. We don't know yet, but in both groups, it's really important to look for the presence of co-occurring mental health difficulties.
Is it fair to say that there is a social contagion at play with this rapid onset group?
Well, as one of the speakers at this meeting mentioned yesterday, humans are social animals and we influence each other. And the idea that gender dysphoria in part might be affected by social influencing factors, which is something that Littman advocated, hypothesized about in her 2018 paper, is a completely reasonable hypothesis.
And still stands to be a hypothesis. Just to switch gears a little bit, how have politics and or legislation acted as a form of censorship against or circumvented a clinician's ability to treat their patients and practice evidence-based medicine?
Well, I think the intrusion of politics into the consulting room actually started on the political left with the addition of the, quote, banning of any efforts to treat a minor's gender identity was added on to legislation that initially was devised to ban efforts to change the sexual orientation of adults. And I think that has had a somewhat chilling effect on clinicians' comfort in working with little kids who have gender dysphoria, because they don't read the fine print in the legislation where it says it's okay to explore a child's gender identity or a minor's gender identity. But the legislation is very ambiguous because it doesn't tell the clinician, well, what does exploring actually mean? And so the average clinician might say to himself or herself, why should I risk it and get into trouble for doing something that I'm not supposed to be doing? So I think the initial intrusion by politics actually began on the left. Now there's a lot of pushback coming from people who feel that there's been too much intrusion into the lives of their kids, for example, in the schools, who might be initiating treatments without parental consent, which I think is very concerning because it's splitting families apart by not involving parents. And now we have legislation in the so-called red states in the U.S. where they're banning any type of biomedical treatment for minors. And we don't know how that's going to all play out because this will go through various levels of appeal.
Right. Another point that you mentioned in your address was that we're in the middle of a storm. And so how can parents, concerned parents, regulators, medical professionals alike, how can they weather this storm while upholding the innocence of the malleable minds of children?
Well, I think ideally parents want to consult with a professional who has experience in understanding gender identity development in children, who is willing to do a good evaluation of where their kid is at, and to discuss with parents what are the various options for helping their child. Because I think the goal of any treatment is to reduce the suffering that kids experience who are experiencing gender dysphoria, and you can't just come up with a solution to that in 20 minutes.
Right. Last question. What would your message likewise be for parents who are increasingly concerned with that school overreach and in the publicly funded system, where they're approaching the topic of gender identity and sexual orientation in not only a very ambiguous way, but also taking that to the next level to really affirm and reinforce the idea of social transition?
Well, my view about that is that, let's say an 11 or 12-year-old asks a teacher or a principal at school, I want to use different pronouns, I want to use a different name. And the reason they're making that request is because they're experiencing gender dysphoria. Now, on the surface, those requests may seem benign, but it is important to recognize that accommodating that request is a form of psychosocial treatment of a mental health condition. And as much as I respect teachers and principals, they know full well that they are not authorized to treat a mental health diagnosis. And that's why it would be important to bring in a school social worker, a school psychologist, a school child psychiatrist to come up with a treatment plan.
And then, sorry, I know I said last question, but one thing that you did touch on there is the argument on the other side, which is that the children will be unsafe at home if they bring this ideation home to their parents, at which point there is also a mechanism in place, which is Child Protective Services. Can you share a little bit about that with the viewers who may not be aware that there are these protective mechanisms in place that are better suited to treat children having this kind of dysphoria?
Sure. I mean, let's say a kid is doing really poorly at school and is getting really lousy grades, and the kid says, please don't send my report card home because if my parents see it, they're going to beat me up or kick me out of the house. Well, that becomes a child protection issue. You wouldn't automatically say, okay, we're not going to send your report card home. But clearly a child is telling the school that they are feeling quite vulnerable. And I would say the same thing would apply to any mental health condition. If my dad finds out that I'm cutting myself, he's going to kick me out of the house, or he's going to beat me up. Or if my dad finds out I have gender dysphoria, the same thing. That becomes a child protection matter under categories of emotional abuse, maybe physical abuse, and then that's the job of the school to seek out a consultation with child protection.
All in all, it seems that schools are just very much not equipped to deal with the complexities of an identity crisis.
Maybe above their pay grade.
Fair. Thanks so much, Ken. Appreciate your time. If you appreciate that Rebel News could be here to provide exclusive coverage of this conference, Free Speech in Medicine, and can travel to bring you on the ground, boots on the ground journalism, then please consider donating to help offset the costs of our travel and support our work at rebelfieldreports.com. At that website, you can find all of our reports on this topic and more. So please head over there and chip in if you're able to, so that we can continue to bring you this important work. That's rebelfieldreports.com.